one of the sessions will focus on advances in the treatment of non-metastatic non-small cell lung cancer. As you know, non-small cell lung cancer is the most common type of lung cancer. And a lot of focus has been on metastatic disease, where, based on biomarker-directed therapy, there has been significant advancements, improvement in survival. But we should not also forget that there are people with localized disease who can get treated with historically curative intent, surgery, radiation, where taking some of the lessons learned from metastatic disease and applying it appropriately to people with more limited disease can actually improve the odds of survival and cure. So the focus here this year is on patients with non-metastatic disease. Another area that I think is increasing in importance and recognition is the treatment of what we call oligometastatic disease. So it perhaps used to be thought that metastatic disease means diseases or cancers all over the place. But we've recognized that it's not a one-size-fits-all. There's many people, especially with new advances in treatment, that may develop metastatic disease in only one or a few sites. And those persons can actually be treated differently than someone with diffuse metastatic disease. So we're going to actually have a session that focuses on what can you do in patients with oligometastatic disease. Another area in lung cancer that we're going to update this year is the treatment of small cell lung cancer. Now, small cell lung cancer historically has been a small proportion of lung cancer, maybe only about 15%. And there really hasn't been that much that has changed in the last 2-3 decades. But last year, there were some studies that were presented that showed significant improvements in survival with people with small cell lung cancer, particularly with the use of immune checkpoint. It was a huge improvement. And there's a newly approved drug called a BiTE, a bispecific T-cell engager. It's kind of related to a T-cell, but some people call it sort of off-the-shelf T-cell, which has also been approved for small cell lung cancer. So we now see in the past year significant changes that, small cell in the past was, we thought, well, that there wasn't much advances. AI is now permeating every aspect of our lives. Where AI might be useful specifically for thoracic oncology, and I'm focusing in on this area. Let's start with AI for lung cancer screening. We do know that there is good reason to screen persons with a smoking history for lung cancer, and that saves lives. But looking at a bunch of CT scans is tedious work. You're looking for little spots here. And AI has been shown in that area to improve diagnostic efficiency. So from that standpoint, AI can be very helpful in increasing the number of persons diagnosed if they undergo screening with early stage lung cancer, where it is most curable. Other areas where AI is helpful is that we believe that AI could be used to help record, or that patient reported outcomes can be analyzed by AI to give clinicians a better idea of what patients are truly experiencing, their quality of life. Because when we ask patients, number one, there's a lot of questions. Patients have a lot of questions and answers, a lot of information, and clinicians are faced with short time. So AI could maybe help us drill down into, is this a situation where the patient is facing something that we need to address with greater priority than not. There are other areas of AI that I think are, perhaps more aspirational, but AI can actually help us do better drug discovery. So AI is increasingly now being investigated as ways to say, all right, if you have a cancer, lung cancer, which are the targets and which are drugs that can be developed to address a target so that rather than a hit and miss, AI can shine a light, for example, at the most promising therapeutic areas of investigation. So AI spans a whole lot of range, and we still have to be careful that even with AI, and one of the areas of discussion is, yes, AI is very promising, but how do we maintain human oversight? How do we let AI help us, but not lead us astray? Comprehensive care of cancer is not just giving, surgery, chemotherapy, radiation. At the end of the day, there's a person there. And two things, as we introduce new treatments, as patients live longer, and as clinicians have gotten, I think, more knowledgeable, we recognize that treatments have effects on patients. They may live longer, but we need to be cognizant of the impact that the treatments have on patients, on their quality of life, on symptoms. And distress and mental health are very, very commonly encountered by patients and their caregivers, and perhaps not previously recognized. Sort of the simplistic viewpoint was, if you got cancer, let's throw everything we have at that cancer and hope we get a good outcome. But we also realize that cancer and treatment has multifactorial areas, and patients do experience a lot of mental health issues. Uh, uh, they have depression, they have anxiety, and those actually can impact not just their ability to tolerate treatment, their ability to complete treatment, but also their ability after treatment to reintegrate into their normative life experiences. So that's one of the reasons why we want to address mental health considerations. Lung cancer remains one of the most common cancers, and despite the advances that have occurred, it's still a primary cause of disease morbidity and mortality. We have improved, but there's still a lot of room to go. So many oncologists are going to see patients, a substantial number of patients with lung cancer, whether it's non-small cell lung cancer, small cell lung cancer, more uncommon mesotheliomas, but they're all an important part of patient presentation. And we want to emphasize that there are advances in which patients can lead better lives and longer lives with this treatment. So it's also, I think, a testament to science development that there has been a lot of research in lung cancer, and that has led to the development and approval of new treatments. So one of the goals of NCCN is to make sure that we educate clinicians as well as patients, caregivers, about what the new treatment options are.